Hey everyone, welcome back to our channel. If you've ever woken up with a stiff neck or felt pain radiating from your neck into your arm, this video is for you. Today we're breaking down the most common causes of neck pain, including cervical disc herniation, radiculopathy, and how to figure out whether it's your neck or your shoulder that's causing the pain. Stick around till the end. We'll also talk about when you really need an MRI and when surgery is actually necessary. Let's start with the basics. Neck pain can come from many things, but one of the most common and important causes is a cervical disc herniation, especially at levels C5, C6, and C6, C7. When a disc bulges or herniates, it can press on a nerve root, and that's when the pain starts traveling from your neck down your arm. That's called cervical radiculopathy. So how do you know if you've got this? Look for these symptoms. Neck pain that radiates into one arm, numbness or tingling in your fingers, muscle weakness, and pain that worsens with certain neck movements. Each nerve root affects a different area. For example, C5 controls the shoulder and biceps, C6 goes to the thumb, C7 affects the middle finger, and C8 covers the little finger. So if your middle finger is tingling, guess what? That's probably C7. Now here's a trick to figure out, is it really your neck or is it your shoulder? Try this test. Raise your arm and rest your hand on top of your head. If that relieves the pain, it's likely from your neck. Why? Because that position reduces tension on the nerve. But if shoulder movements make the pain worse, then the problem might be in the shoulder joint itself. To confirm a diagnosis, doctors check muscle strength sensation in the arms and hands reflexes, like the biceps and triceps reflex. They might also do a test called Sperling's test. Turn your head toward the painful side and gently push down. If that triggers the pain, it's a positive sign of radiculopathy. Now here's a very important point. Just because your MRI shows a disc bulge doesn't mean it's causing your symptoms. Studies show 28% of people under 40 have disc bulges and feel nothing. 57% of people over 40 have at least one degenerated disc, with no pain at all. So don't panic if your MRI sounds scary. It might just be age-related wear and tear. Most patients get better without surgery. Start with non-steroidal anti-inflammatory drugs like ibuprofen. Physiotherapy is also a great option, along with stretching and strengthening exercises. Sometimes a soft cervical collar can be helpful. If things don't improve after 6 weeks, that's when doctors might consider getting an MRI or referring you to a specialist. So when do you need surgery? If the pain lasts more than 6 to 12 weeks, there's muscle weakness or progressive symptoms despite all treatment, then surgery like anterior cervical decompression and fusion might be necessary, and it usually works very well. Now here's something you shouldn't ignore, a condition called cervical myelopathy. Signs include trouble walking or balance issues, hand clumsiness or difficulty buttoning a shirt, weak grip strength, and numbness or stiffness in the hands. This happens when the spinal cord is compressed, not just a nerve root. It's more serious and needs early surgical treatment. Neurological signs like positive Hoffman's sign, Babinski, and clonus indicate upper motor neuron involvement. Not all neck pain is from discs. Some other causes include muscle strain, which usually improves with rest and therapy, arthritis, which involves degenerative changes in the cervical spine. Infections or tumors, although rare, are important to consider. Suspect them if pain worsens at night, doesn't respond to rest, or comes with fever, weight loss, or a history of cancer. Also, in some people, nerve compression can happen in 2 places, called double crush syndrome, one in the neck and one in the wrist, like carpal tunnel. So to wrap up, most neck pain gets better with simple treatments. Don't rush for surgery or panic over an MRI. But if you have serious symptoms like weakness, gait problems, or persistent pain, get it checked. If this video helped you, don't forget to like, subscribe, and hit that notification bell so you don't miss future videos from Global Wellbeing. Have questions? Drop them in the comments. I'd love to hear from you. Thanks for watching, and take care of your spine. Visual end screen with channel logo, suggested videos, and subscribe button.